I'm Dr. Craig Beach, founder, psychiatrist, and CEO of Open Mind Health.
Can you tell me a little bit about your own mental health journey?
So, my mental health journey began growing up in a small town in Canada that just happened to have the maximum secure psychiatric hospital for the equivalent of the state. And both of my parents worked at that hospital. And so, growing up, I needed a job. And so, my first job was at that hospital that both of my parents worked at. So, that was my first exposure to the mental health field and also having parents who worked in the mental health field. So working at that hospital exposed me to kind of how interesting and also kind of serious emotional problems can be. And that sparked my interest in becoming a physician and ultimately a psychiatrist.
What is it like carrying your parents' legacy?
Well, my parents worked in slightly different areas. My
Yeah.
mother worked in medical records at that hospital, and my father was a nurse. And he said he always functioned more like a social worker because he was focused a lot on helping people through talk therapy. So that really relates to me because obviously, as a psychiatrist, one of the main things you do to try to help people is talk therapy.
What inspired you to start your own practice?
Well, what's prompted me to start Open Mind Health is what I had experienced and learned over about 20 years working in the mental health field in numerous capacities, ranging from private practice, the criminal justice system, state hospitals, corrections, and county clinics, and healthcare administration. And I wanted to basically be in a position where I could offer clients something that was holistic, meaning that in addition to the traditional talk therapy and medications, they could benefit from non talk therapies, for example, complementary and alternative modalities like hypnotherapy, music therapy, art therapy, Reiki, Tai Chi, yoga, and many others. And also, Open Mind Health is 100% virtual, but I wanted to not just offer access, which is common when there's a shortage of providers, for example, in rural areas, but I really wanted to focus on making sure that we were offering culturally affirming care that was a good fit for clients. And so, one of the things we did at Open Mind Health was create 21 wellness tracks, which are really designed to support diverse populations like BIPOC, Latin, X, Hispanic, Asian and Pacific Islanders, South Asian, and many others, LGBTQ, military and veterans, women's mental health, and employees to get to those root causes.
And for some people, it takes a lot of courage for them to see a psychiatrist. And for me, I live with bipolar disorder too. And that was the big thing of nerve and stigma of going to a psychiatrist. But how is it that when you bring people in, they feel supported?
Well, one of the big things to combat stigma is education by making people realize, by validating that people are not alone, that there are treatments that are effective and they're not struggling alone. And so, one of the things we do through the wellness tracks I mentioned is we let people know that we specialize in those areas, and that tells people that they have a home at Open Mind Health and that we're devoted to caring for their particular needs, including the unique challenges that those diverse populations have traditionally experienced.
What is it like for you to be helping others?
Well, I think it's a great honor to be able to give back. I in my social group as well as family. I've had people who have experienced mental illness, so it's not only something professional, but it's also personal. And I feel the more we can help people see mental health as a critical component of overall health, the better. And the more we can reduce the stigma, the more people will proactively look to work on becoming their best self and taking care of themselves. So it's not the situation where people wait until they're hardly sleeping at all, or they're vibrating with anxiety, or they're at a point where they're not sure if they want to live anymore before they access care.
When you start working with people, do you see their confidence level rise as they go through the process?
Yeah, so one thing that treatment can do is it can help people see that there is hope in sight, and that there are effective things that can make things easier and better for people. And one of the reasons people don't engage in treatment is because they doubt whether that would be the case. And so if they experience some initial improvements in the early stages of treatment, that can very much motivate people to want to continue to do the work. And doing therapy, for example, is work. You have to be committed, you have to be willing to show up. There's often homework that's done between sessions. All of those things help to show people that the work that they're doing is paying off, and they're feeling better. And so that in turn motivates people and provides them a confidence, because they also oftentimes, as they're improving, those improvements are not only noticed by themselves, but also others who will provide them with feedback that they've noticed those improvements. So that whole cycle is reinforcing and makes people more open to treatment and to seeing the true benefits of engaging in mental health care.
Since you've started, have you seen the stigma of just talking about mental health lessening?
Yeah, the stigma has significantly improved over time, but it's still a major barrier overall, and particularly in some groups, including some of the diverse populations I mentioned earlier, where, for example, maintaining a kind of strong persona, not showing or not talking about emotional problems, where people are concerned that that could demonstrate weakness, or that someone might take advantage of you. Those things are still common concerns that people have, and reasons that they avoid the mental health care system. And that's why we're very focused on trying to be more proactive, to validate people so that they don't feel alone, and to normalize mental health struggles, because many of the conditions we treat, like depression, anxiety, and addiction, are very common, affecting 10 to 30% of the population at some point during their life. And they'll say that all of us either have experienced, a significant mental health struggle, or we know someone who has a mental health struggle. So really, no one is immune to kind of knowing someone, or being in the position of having experienced mental health difficulties.
And you said something about addiction. How important is it to have mental health care when you're going through something super tough?
Yeah, so the views on addiction have evolved over the years. It used to be the common practice, if someone was struggling with mental health issues and also had challenges with addiction, it would be recommended that you deal with your addiction first, and only after that, that you then deal with the mental health struggles. We've known now for a long time that was not the best way to approach things. That didn't work to help people with addiction, and it only worsened the other mental health conditions. So now we use much more of a model called concurrent, where we treat both the mental health and the addictive issues at the same time. And we know that they're intricately linked. And when we talk about them as separate, they're not actually separate. They're part of the same thing. So you can imagine, for example, there may be situations where the reason that people are using substances at the core of addiction can be a desire to escape. And so people might be treating with alcohol or drugs trauma that hasn't been treated, and they're treating that trauma with alcohol or drugs as opposed to getting mental health treatment for trauma.
What do you do to help your own mental health?
Well, that's a broad question, but I think there's many things. I think it's realize that we're all kind of at risk of struggling emotionally, and to try to do proactive things, like try to get good sleep, get exercise, have a balanced diet. We know that a large part of our happiness in life is contingent on our happiness within, and that it's important to be able to find our own happiness and not depend on other people. And then another big predictor is the quality of our connections. So, surrounding yourself with people who support you and bring out the best in you. Those are some examples of techniques that people could use on a day-to-day basis. And then also, I should mention being grateful, right? There's can always look at life as the glass is half full or half empty. So it's always helpful to try to, for example, do a gratitude journal. And as hard as things may be, and many things may not be going well at times for people, try to find and focus on the things that are going well, because that will help you stay motivated, and be grateful to focus on the other things that are challenging, to show you that you can get through the very challenging things. One other thing I would say is not expecting life to be easy. One of the things that people can be challenged by is they have the fantasy that life's going to be easy, or they think that other people have an easy life because they don't know the details of other people's lives. But if you more open yourself up to the fact that life is meant to have challenges, and those challenges are there to do just that, challenge us. And that adversity is there to make us stronger. Kind of like I guess Kelly Clarkson said, what doesn't kill you makes you stronger. So I would agree with that, to kind of open your mind, to expect life to be challenged, and to take confidence and pride in your ability to tackle challenges and become a stronger person for doing it. And then to be better equipped to deal with challenges in an easier way from your experience and confidence dealing with challenges previously in your life.
Where do you want to see your mission, say, in the next 3 to 5 years?
Well, at Open Mind Health, the mission is to help people become their best self. And so that's individually defined, but includes not only treating reactively emotional issues, but really helping people to think about kind of what are their aspirations and their dreams, and to try to help them see and find a way to make those dreams a reality. Try to break things up that may seem difficult to achieve, or maybe even impossible to achieve, but help people kind of define those things in a way that makes them more doable or achievable. That's the kind of best thing. We want people to be, we want to support people so that they're the absolute best version of themselves, so that they look at themselves and say, day to day and year to year, I'm evolving as a person, and I feel like I'm the best authentic version of myself. Um, Meaning that I'm the true me. I'm not what other people want me to be, or what I think other people want me to be, or I'm not just focused on pleasing other people at the cost of my own happiness, but I've really thought about kind of, who I am and what makes me a unique person, and kind of what I want to contribute, and where I want to be in my life.
How can people reach out and learn more?
So, Open Mind Health is accessible in many ways. One way is on our website, openmindhealth.com, where we have an option to immediately book an appointment. And you can do so by choosing the state in which you reside and the visit type, either talk therapy or medication, or we're accessible by email at info@openmindhealth.com or by telephone 1-855-550-6463.